Welcome back. Thanks for staying with us. Issues of health and gender-based violence are under the spotlight at the Health and Gender-Based Violence and Femicide Summit in Welkom in the Free State. The three-day summit aims to address the gaps that exist between stakeholders in the healthcare sector and communities. Event organisers say there's a need for comprehensive strategies that will incorporate healthcare policy development and community engagement. Now, Free State convener of the Embrace Diversity movement, Benjamin Malgas, joins us for more. A very good evening to you, Benjamin. Thank you so much for your time. Perhaps let's start off with getting a better understanding why you've participated in this event as a movement.
Thank you so much for having me. Let me start by greeting you and the viewers at home. I think to start, the issue of gender-based violence is an issue that is affecting all of us. So it is important for everyone to play his and her role within the country, as this has been declared kind of a problem. It's actually the issue that is really tampering with almost every family within South Africa at this moment.
The summit goes, I know, will be tackling certain topics and exploring some of them and addressing the gaps that exist between stakeholders in the healthcare sector and communities at large. What are some of those topics that you think the public needs to be sensitized to?
I would say there are a lot of issues that has been discussed since this summit started.
Yeah.
And let me appreciate the fact that the municipality, municipality under the Councillor Ntakumbani, that is the executive mayor of Lejoliputswa district at large, has come up with this initiative to say, let's sit around the round table and have the issues, and with inclusion of the LGBTQI. So the topics that we have been looking into in terms of the GBV, it was the LGBTQI. We looked into prevention and rebuilding of social cohesion that was entertained by the social development from the government sector. We also had the issues which were entertained by Department of Health. We had the issues which were entertained by the Department of Justice, Safety. The issue of protection also came up, whereby SAPS and NPA, plus the LGBTQI, formed part of the discussions. However, we had the response care, support and healing that was also part of the discussion as to how do we then heal after this whole GBV issue. Because you would remember that the GBV doesn't only affect you as a person, but it also affects those who are around you. And if you are lucky around this GBV, you would be alive. But unfortunately, some of the people lost their lives. So these are the issues that we had to look into. And the mayor was very precise to say, let's talk about these issues, let's see how do we deal with this pandemic.
As you talk about people who have lost their lives, and that in itself, of course, comes with its varying issues, name calling, harassment, bullying, and gender-based violence. I mean, to mass issues like being denied a job or treated inappropriately at a healthcare facility. Why is it so important to educate the public about these challenges and get society to not have these negative narratives around the LGBTQI plus community? Perhaps sometimes it's a lack of knowledge.
Exactly. You know what? The issue is about education. The issue is about sensitizing the community at large, sensitizing the workforce, sensitizing the government. I would make a typical example. We have this what we call camps at schools during the examination times. Now, one would, at the back of one's mind, one would start to think deeply to say, now, what is happening with this LGBTQI people who are within this part of the camps? Are they treated well? How are they treated? Because now you would find that in these camps there would be boys for boys at their accommodation, and then girls who are supposed to stay with girls, obviously. So now, what happens with this? The trans? Are we really also playing part to say you've got your space within us. So those are the kind of things. The issue of the health sector also, to stay within the facilities, are nurses sensitized? Yes, you might be a nurse, but the fact doesn't mean that the fact that you are a nurse, it doesn't mean that you definitely understand the issues of sexuality. So this is a very vast issue and a very sensitive issue that we need to start educating people. We need to start educating everyone around it as to how to handle the issues around the LGBTQI. And the fortunate part of it, within this summit, we had the religious leadership, and out of the discussions of that, it had so many issues that we had to unpack. So there are still a lot of issues that we need to unpack inside the government and outside the government.
Yeah. As you speak about, sensitizing professionals in the healthcare space, like nurses, what are some of the challenges that some have spoken to, the horror stories that they've endured, that leads you to want to discuss this, hold a roundtable discussion to ensure that there is a level of sensitization and education?
I think in Lejoliputa we are quite fortunate because we have the district supporting partners. These are partners which are funded by PEPFAR and USAID. So in many times they've got expertise of handling such issues, and they are supporting the Department of Health directly. So they do the trainings, they do provide the trainings, but we still feel that we are moving at a very slow pace. We need to start running, we need to get to the police stations. We need to knock in every government office where public goes, where me as an LGBTQI person would be looking for help tomorrow. Because when you look at the offices like within the government sector, SABC, it's very difficult to come and explain your issue of abuse there, because now there would be people asking you questions that shouldn't even be asked. I mean, treat a human being, deal with a human being, don't deal with my sexuality.
What will it take to get there, though? Do you think it's a matter of policy development? What sort of education and on what drive is needed to get to that level of understanding where it's not an embarrassing situation or a place where you're shamed for simply being who you are?
Ma'am, I think the policies are the ones that will be dealing, but we need those also. We need a holistic approach when it goes to issue of policies, because we need inclusion of the very same LGBTQI people to form part of these policies when they are made, so that tomorrow when we sit and we implement the policies that were inclusive of everyone. Because now the problem would be that when you develop a policy without the relevant stakeholder or without the relevant issues of discussion, then it becomes a problem, because now you are dealing with someone's issues that you cannot even explain. Issues might be understandable by you as a person, but let the correct person guide you as to what is happening. Yes, expertise of building up a policy, yes, of course I need it, but include this very same LGBTQI people.
Very well. Thank you so much for speaking to us this evening. There you have it, the Free State convener of the Embrace Diversity Movement, Benjamin Malgas, saying that include the LGBTQI plus community when it comes to policy framework.